Imagine the scene of a serious accident. In those first few chaotic moments, some of the most critical decisions are being made in a split second. And for a severely injured person, the choice of which hospital to go to, well, that's not just about what's closest. It can literally be the difference between life and death. So today, we're going to dive into a radical redesign of how paramedics make that call, a brand new national guideline for field triage that's set to save more lives than ever before. First, to really get a grip on this, you have to understand the scale of the problem. For anyone under the age of 45 in the United States, the number one thing that kills them isn't a disease, it's an unintentional injury. It's the top reason people call 911. This isn't some rare thing, it's a daily, nationwide health crisis.
Okay, so that leads to a huge question, right? When paramedics show up to a chaotic scene and someone's life is hanging in the balance, how do they decide where to go? Do they race to the closest hospital, or do they go to a specialized trauma center that might be farther away? Believe me, that decision is anything but simple.
And there's a name for this whole process. It's called field triage. It's really all about one thing: quickly sorting through patients to figure out who has those truly life-threatening injuries and needs the high-tech resources of a trauma center versus who has less severe injuries and can be treated at a regular hospital. Getting this right, it's the bedrock of our entire trauma system.
And the stakes? They could not be higher. A massive study showed that seriously injured adults who were taken to a top-tier Level 1 trauma center had a 25% lower chance of dying within a year compared to those taken to a non-trauma hospital. So the bottom line is, getting the right patient to the right place literally saves lives.
But making that call on the field, it's a huge challenge. Paramedics are in this constant, high-stakes balancing act between two really dangerous outcomes.
On one side, you've got under triage. This is like the absolute worst-case scenario. A patient who desperately needs a trauma surgeon gets taken to a local hospital that just isn't equipped to handle their injuries. That's a potentially fatal mistake. And then you've got the flip side, over triage. That's when someone with pretty minor injuries gets taken to a trauma center, using up precious beds, staff, and resources that are really needed for the most critical patients.
So when you're staring down those two risks, the system has always made a really clear choice. The whole philosophy has basically been better safe than sorry. The priority is to avoid under-triage at all costs, even if it means you have a bit more over-triage. The thinking is simple, right? It's better to potentially waste a resource than to lose a life. But here's the really shocking part. Even with that super cautious approach, the old guidelines were failing our most vulnerable people. I mean, just look at these numbers. A staggering 50% of severely injured children and older adults were being under-triaged, sent to the wrong hospitals. Half of them. Clearly, something had to change. Big time.
And well, that change finally came in 2021. An expert panel completely rethought the national guideline. They basically threw out the old confusing system and built something new from the ground up. Something designed for clarity and accuracy right where it matters most, in the back of a moving ambulance.
You see, the old way of doing things from back in 2011, it was this really rigid four-step algorithm. Paramedics were supposed to work through it step by step. But in the real world, under pressure, that's just not how information comes at you. And the feedback was loud and clear, it was just too complicated to use effectively. So this new guideline, it just completely tosses that old structure. It's been redesigned around two incredibly simple, intuitive categories: high-risk patients and moderate-risk patients. This just makes so much more sense because it aligns with how medics actually think and make decisions on a scene.
And here it is. This is the solution, the 2021 National Guideline. Right off the bat, you can see it's totally different. It's not some crazy complex flowchart anymore. It's more like a clear, color-coded roadmap that's built for speed and intuition in a high-stress situation. Let's break down how it actually works.
The whole idea here is just beautiful in its simplicity. If a patient meets any of the criteria in the red section, they are high risk, period. They need to go to the highest level trauma center you can get them to. If they don't meet any red criteria, but they do meet any in the yellow section, they're moderate risk and should go to a trauma center. And check out the design. It flows from top to bottom, from highest to moderate risk. And it flows left to right, perfectly matching the order that paramedics typically assess a patient. It's brilliant.
But this wasn't just a facelift, The changes go way deeper than just a new layout. The actual criteria have been updated with the very latest evidence to be smarter, faster, and, at the end of the day, a whole lot safer for patients.
Let's talk about three of the biggest game changers here. First, there's a brand new criterion for severe bleeding. If a patient needs a tourniquet or has their wound packed, they are automatically high risk. Second, checking a patient's level of consciousness is now way simpler, making it faster and more accurate. And third, and this is huge, there are now specific vital sign criteria just for kids and for older adults, directly targeting those awful under-triage rates we saw earlier.
Okay, let's zoom in on that simplified consciousness check, because this is a perfect example. The old guideline made paramedics calculate something called a Glasgow Coma Score, which is this complex 15-point scale. Based on direct feedback from thousands of medics, the new guideline replaces all of that with one single powerful question. Is the patient unable to follow commands? It's just as effective, but it's infinitely more practical to do in the back of a moving ambulance.
And really, this all comes back to the main mission here. Almost every single one of these major changes, from the new age-specific vitals to even adding the suspicion of child abuse as a factor, was made with one primary goal in mind: to stop failing our youngest and our oldest patients and make absolutely sure they get the life-saving care they need.
So, okay, we've seen all these different pieces, the new layout, the smarter criteria, the focus on vulnerable patients, but what does it all add up to? Why is this one document such a big deal?
Well, because this is so much more than just a document. It's the frontline strategy for our entire national healthcare system. It's a tool that's packed with evidence, designed to make sure that where you're taken after an injury isn't a game of chance, but a matter of smart, fast, and reliable medical protocol.
And let's not forget what's really at stake. That 25% reduction in mortality, that's not just the statistic. It represents thousands of people, parents, kids, friends, neighbors, who get to go home to their families. Getting triage right is what makes that possible.
You know, this whole story is just such a powerful reminder. Sometimes the biggest breakthroughs in medicine aren't some fancy new drug or a surgical robot. Sometimes it's about looking at a problem with fresh eyes and just asking, how can we make this smarter, clearer, and better? How many more lives can we save just by rethinking a single form?